Hi, Josh, registered pharmacist with pharmacisttips.com. Here just to chat a little bit about metoprolol tartrate, the 25 milligram tablets. What is metoprolol tartrate? It's a medication known as a beta blocker. The nice thing about metoprolol is it's what they call cardioselective, meaning it's more likely to interact with the beta receptors in the heart. That means that it has less effect on breathing versus some of the other beta blockers. Like people with asthma sometimes cannot tolerate certain beta blockers. This does seem to be dependent on the dose. So as you go up in the dose of metoprolol, it is possible to have some breathing issues. And of course, you'd always want to be mindful for that. Of course, it lowers blood pressure and it's been shown to improve heart function with angina. Angina being heart pain when there's inadequate blood flow to the heart. So what's it used for? Of course, it's used for angina. It's used to lower blood pressure. They put people on beta blockers after a heart attack. It's been shown to reduce the chance of a second heart attack and improve outcomes. Off-label, meaning it's not specifically indicated, but many times used for arrhythmias, headache prevention, and other things as your doctor has determined. So what is the dosage? Well, typically for blood pressure, the literature recommends up to 50 milligram twice a day with a ceiling dose of 450 milligrams total per day. Angina, again, 50 milligrams twice a day, no more than 400 milligrams a day. But because of the fatigue we can sometimes see with metoprolol, we often see healthcare providers starting at a lower dose, more like the 25 milligram twice a day, or they may even have you break that tablet in half to a 12.5 milligram dose twice a day. Often this just improves patients' tolerance of this medication. And then over time, the dose may be increased, but it seems like starting folks on that lower dose just means that they can tolerate the medication better. Some side effects to watch for, of course, as it affects blood pressure, it can work in a sense too well, lower your blood pressure too much, make you tired and weak. And again, this is what we talked about oftentimes healthcare providers starting folks on a lower dose to kind of mitigate these side effects. We could also see some anxiety, depression, insomnia, nightmares. Now, don't be scared of that because it doesn't happen in everyone, but it can happen. And if it does, you want to be sure to talk to your doctor. Blurred vision, stuffy nose, difficulty breathing. So there we get into those, the caution in asthmatics and things like that. Again, this typically we don't see that, but we should always be mindful of that. Those things can happen, especially as the dose of the medicine goes up. Watch out for itching, rash. Of course, almost every medication has the side effects of diarrhea, constipation, nausea. We want to watch for that. And any others may occur, so contact your doctor or pharmacist if you feel you may be having side effects from metoprolol tartrate. Thank you for watching this video. As always, be sure to contact your healthcare provider right away if you feel like you're experiencing problems with your medication. Always watch for side effects and interactions. Just the sooner we notice those things, the less likely they are to be an issue for you. If you find this information useful, please subscribe to my channel here on YouTube. And if you have any questions for me, swing by pharmacisttips.com/ask.